Dr. Greg Jones Optimization Academy. I am very, very honored today. I'm honored with all of my guests, but I'm especially honored today to have Dr. William Seeds on the show. For those that don't know, Dr. Seeds is a board certified surgeon practicing medicine for over 25 years. He is the founder and chairman, or the founder, of the International Peptide Society. And currently, he is the founder and faculty developer and head honcho of the SSRP, the Seed Scientific Research Program. So we'll talk about that here in a little bit. It's an amazing program for the docs and people that are into peptides that don't know about it. And he is a leading peptide therapy researcher as well. He is the chief of surgery and orthopedic residency site director for University Hospital in Canoet, Ohio. He has been honored at the NFL Hall of Fame for his medical expertise in treating professional athletes and serves as a official medical consultant to the NHL, MLB, NBA, and NBC's Dancing with the Stars. Without further ado and no longer waiting, welcome to the show, Dr. Seeds.
Dr. Jones, thank you for having me. I appreciate that introduction.
Thank you. So let's talk about the SSRP really quick. Talk to us about that, because that may be a new term or a new organization for many of our listeners here today.
Sure, that's a scientific research institute that I've had for over probably the last 15 years, and where a lot of my original work started in focusing on the integration of peptides into clinical practice, and where basically the idea came to fruition now of where we could start a group of healthcare providers all interested in the same aspects of improving patient outcomes, really focused on cellular mechanisms and really getting to the root cause of problems, and bringing all of those things that we've kind of known about, but we've never been able to maybe put together in helping us understand disease and aging and performance, and how we can use all of those to really become better providers for our patients, and better, and also better representatives of what we're representing. Because, all of our patients kind of look at us like, are you really, Dr. Seeds, I know you talk a lot about this, but are you representing this? And so I think we've done the SSRP has been something that's really grown in the last couple of years, year and a half, basically, that just, it's expanded exponentially now into every part of medicine. And it's exciting because we're attracting everybody, which it should be, right? It should be all of us collaborating together on understanding how we can all make our patients better. And that's the exciting part. It's kind of like I always say, let's get everybody together, let's talk, and let's make sense of some of these, of a lot of these mechanisms that we'll still be talking about 20, 30 years from now, and we'll still be trying to figure it out, but at least we started the conversation.
Excellent. And I'm going to make a quick correction here. I called it the Seed Scientific Research Program. Is research and performance. And I like that it's performance. We're going to talk about that a little bit more at the end of part one and more about it in part two. So, just to give you guys some background is that, for me, peptides are relatively new. I'm a naturopathic doctor by trade, so we don't exactly, I don't know if you guys learned about it in allopathic medical school. We don't learn about this in school. Like, we know what peptides are. We know that they're sequences of amino acids, but we don't know how to necessarily use them to improve patient outcomes, because you can get into the whole FDA approved, regulations of that. But again, it is what it is. We learn as we go. But the more my eyes have been open to peptides, I want to learn more. And so I kept hearing your name. I kept, as I was learning about the different peptide suppliers and compound pharmacies, and it's Dr. Seeds. I'm like, Dr. Seeds does it this way. I'm like, who's Dr. Seeds, right? And so, at that point, once I found you, and the SSRP got started up, and then I went to the first conference because it was during the middle of COVID here and all that good stuff. I attended virtually, and it was amazing because there were a lot of doctors who I had been following in the peptide world, all in one room, and all discussing these tough cases and different ways to apply apply the science, and ways to think about the cellular pathways and how we can actually improve patient outcomes, different than not just giving a supplement or a medication, but how these things all work together to improve the cellular environment. So ever since then, to me personally as a doc who's growing their practice and learning more about this medicine, it's been a godsend. So I definitely encourage any doc out there that wants to learn more about peptides and cellular medicine, great direction to go. Now that I've done the free advertising piece of it, and I've said the cellular medicine word a few times here, Dr. Cease, for those that don't know, because this may be an unfamiliar term to many people out there, what is cellular medicine and how is that different than medicine?
Well, cellular medicine is just, it's appreciating the makeup of the cell and why it's important and what the cell wants to be efficient. And why is that important? Health and performance, it's all based on the cell being in a homeostatic place, meaning there's not too much of something and there's not too little. You want that cell to perform at its best, and the cell performs at its best when it's even keeled. Yin and yang are just right. And people don't understand that enough. People think the cell needs to be hyped up to perform better. That's absolutely wrong. The cell needs to be able to the cell is inherently intelligent, way more intelligent than all our minds that we could put together around the world. It knows how to utilize glucose and fatty acids and proteins and at the right and appropriate time to make the mechanism of the cell perform at its highest capability. So in order to take advantage of that in everyday life, in aging or performance or in illness, we need to understand those pathways and the significance of how the cell potentially might make decisions to improve its present condition to get to that efficient state. And that is, if you start thinking that way, then you can start thinking your way through problems. You can start thinking your way through disease. You can start thinking your way or start understanding and appreciating why exercise and nutrition are about everything to making your life incredibly less complicated, but better for the cell. And then if you understand that, then you have the luxury of understanding other things to improve upon what you're already doing. If you're already doing the benefits of exercise and nutrition. So the cell, the cellular medicine is just appreciating what the cell already knows and understanding those mechanisms and then making them work for whatever purpose is necessary, whatever you're encountered with. If it's just living well. Just living well is something, is science itself, I think, at its best in the cell. And that's where it does come together, of bringing in the proper nutrition and the proper exercise and sleep and all of these things that people may think are things that they commonly hear about and don't need to pay attention to yet those are things that they can actually change today and tomorrow. And then all the other things we can start adding in and make them better and smarter at understanding these things and then really appreciate how important understanding that cell metabolism is. So it's really just understanding those basics, I think, that make a difference in how we approach everything. And that carries over to all sides of medicine. It carries over to nephrology, cardiology, orthopedics, ophthalmology, psychiatry, neurology. It's everything, So if you understand the cell, you can talk with other people in other specialties and make sense of what they're discussing. And that's the beauty of I think, understanding the cell.
And it's great that you brought that up, because as you're saying all that, as I've sat as an audience member and at the lectures and the conferences, when I think cellular medicine, I just think medicine, man, because that cell environment, that cell communication, how efficient the cells are, how they perform metabolism, how autophagy and senescence work together, that's all the cell. So if your cells are not optimizing, if you're not optimizing the performance of your cells, you're not optimizing your health, because all those systems we talk about inflammation, we talk about gut health, we talk about brain function, we talk about mitochondrial function, it's all cellular medicine, man. That's what it is, and it's just the understanding of that. and stepping back, because again, it's so easy for us to say, hey, you got this, take that.
Yep.
And not understanding how that thing, that pill, that injection changed that cellular environment, what are the downstream effects of that. So I think that's super important, for any doctor, any patient that's listening, like, it's the give and take. I always tell my patients, there's no free lunch in medicine, man. I give you something, something's going to change.
Yes.
And understanding what that change is. And I think that's where the breakthrough comes in. I think that's where the future comes into how we practice.
You're 100% right, Greg. You're right on target. And it's so refreshing and a pleasure to hear that from our younger group out there that are going to take over the world soon. And I consider you one of those people for sure.
Thank you. I appreciate that. So that being said, Dr. C, is like when it comes to cellular medicine, because again, when I title this podcast, there's going to be peptides in the title. So with that being said, where is that conjunction, that orchestration between peptides and cellular medicine? Where does that introduction happen?
Sure. And that's a great question, because, when I was tasked to start teaching about cellular medicine, it's like, how do you start introducing something that people really don't, that they may not even understand where you're going to start from? How are you going to put this message and get it started out there in this world today? If we go back maybe 6-7 years ago, when I first started introducing all of this into lectures, and then into courses, and then into programs and societies and so forth. Well, the best message was to be able to use peptides, because peptides are signaling agents, and peptides are natural signaling agents that we have in our body. We have these signaling agents that are, they can be enzymes, they can be hormones, they can be ligands, they can be receptors, but they're natural to the human body. And so the body understands what these signaling agents, which are just a bunch of amino acids connected by peptide bonds, and they can either be straight or cyclical or helical, or they can be in many different fashions. And these conformational changes will determine how they react in the body. And basically, peptides were this cool way to start bringing this cellular medicine topic to the world here, because peptides were something people were interested in, but they didn't know why. They didn't know why they needed to be interested in it. So it was being able to bring that in and say, okay, well, let me show you the bigger picture of, you may know, or you may have heard about these, but why are they important? Well, it's because they're natural signaling agents that have quite a bit of significance, and we can show you how they're being utilized, show you how they've been around, early 1960s, like insulin itself, and which people don't realize that's one of the original peptides. Was the Nobel Peace Prize was won on insulin, and then how all the literature just started exploding from that, and how it's just unstoppable right now. That it only makes sense. Why don't we study these naturally signaling agents instead of trying to make up molecules that the body doesn't recognize and sees as foreign invaders? Why don't we find things that work and the body knows how to use? And hence that was easy to start with. And I said, well, peptides will be the easiest way to introduce this. And then, so we started with peptides, and then we just grew, and it became a much bigger subject than just peptides. But peptides was the way to kind of bring people in and just say, well, what's this about? And so now it's been out there long enough that now people kind of get it, like, okay, there's a bigger story to this, and it's this cellular medicine.
That is an awesome way to put it, because again, and that's what drew me in. If you recall when I mentioned how I got involved, like it was all about peptides. Like, oh, I want to learn more about peptides. I want to learn more about protocols. I want to learn like different peptides have not been exposed to. But then you get into these conferences, you get into the groups, even on the message board, the discussion board, on the SSRP website, you start looking at these things, and it's like, wait a minute here. Like, I know, don't just jump right into peptide here. Like, what about the foundations of health? Like, what are they, is this person even exercising? Like, wait a minute, I can give you a peptide to improve your body composition, but if you're not exercising, what are we really doing? We're not going to get the improvement, right? So stepping back, improving the environment, that arena, that entire environment to make someone perform more optimally, right? And so I think that's very important to note, that it's not just, here's a peptide, and I think that's kind of unfortunately, I think in the marketing side of it, I think that we've kind of got stuck, and I don't say we as in just doctors like, oh, I got this peptide here. And you know how wonderful they are. You want to get people on them, but if they're not ready, they're not ready, and we want to make sure that we're doing it, maybe not ready for certain peptides, maybe not all the peptides, right? But I think that's very important, is to look at the entire environment. So I appreciate that for someone who just wants, me personally, my instinct is just give them all the peptides. And I love the t-shirts. There's a peptide for that. And in most cases there is, but is it the right time? And I think that's such a big part of it.
Well, that's a really good point, and you hit it on the head of and how there's you got to set the environment. Why not set the environment right for these to work even better? I mean, you're forced to use them sometimes early on, and when you don't have the advantages of working on the gut or working on the nutrition and the exercise, and you're forced to maybe start a little bit early, but it doesn't stop you from doing all the things you know how to incorporate to really overall change the overall health of the patient, to make these signaling agents work at a better place. And that's changing all of those things. So you're right on target with that, Greg. I mean, I think that's really important what you said, and for you to recognize that as a young doctor is really important, and that speaks highly for all of your patients. So I love hearing that from you.
Thank you. I appreciate it. So, all right, y'all, that has been just about it for part one. And I know everyone's chomping at the bit, so we want to talk more about peptides, and we will in part two. So be on the lookout for that. But before we let Dr. Seeds go, first of all, thank you for coming on the show, for here for part one, and we will have a part two very soon. But to close this out, Dr. Seeds, where can we find you?
Wow, that's really good. I don't know. I think you can find me on, you mean, so you can go to the SSRP. I don't even know what my website, I think it's ssrp.org, I believe. And I'm on Instagram. I think what Karen will have to do is give you all my links, and you can just plug them in here. She's good at that, but I know a lot, but I don't know a lot about that stuff.
It's okay. It's actually ssrpinstitute.org.
Oh, thank you.
Gotcha. I got you. I spent enough time on that website, man. I got you covered there.
See, I just click buttons and I'm there.
All right. And then let me see here. I want to make sure we got your Instagram is at Dr. William A. Seeds, MD. So William A. Seeds, MD. That's your Instagram, man. So we got you covered here. So make sure
Thank you, Greg.
And we will have all the links on how to get more information on SSRP and more information about finding Dr. Seeds in the comments, or actually the write-up of the podcast and the YouTube channel, all that stuff. So for those listening, you will be able to find Dr. Seeds and learn more. But for now, we're going to wrap this up. We're super excited for part two, and we'll see you all soon.
Thank you, Greg.
Thank you.